Hi, my name is Dr. Igor Kozak and I work at the Moorfields Eye Hospital in Abu Dhabi, United Arab Emirates. We are currently facing a large epidemic of COVID-19 disease, which is rapidly spreading all around the world. And we as healthcare professionals need to continue to care for the patients, and actually we want to be a part of the solution. So even in these times with social distancing and movement restrictions and reduced clinics, there will be patients that will visit ophthalmology centers. Therefore, it's very important to protect ourselves and to protect our patients. I would like to share my thoughts on how to do this practically, how we do it in the Middle East, having had some experience with the Middle Eastern respiratory syndrome. The priority, of course, is to avoid contact as long as possible. Try to reschedule the patients whose problems are not acute or can be rescheduled. One of the ways, useful ways, is teleconsultation before the patient comes in. In the Emirates, we have been using Telemedicine, and the Ministry of Health has actually set up a series of codes, billing codes for insurance companies, so that this is a billable and payable practice to healthcare professionals and ophthalmologists. If the patient really needs to visit the clinic and the visit cannot be avoided, then we follow certain guidelines such as those outlined by American Academy of Ophthalmology or Royal College of Ophthalmologists. We at our center have a triage team at the entrance to the clinic who interview patients, check their temperature, and if there is a suspicion for possible infection with COVID-19, these patients are then redirected to centers that are fully equipped for this kind of services. If the patient is cleared by triage team to be seen at the examination room, then these patients and their limited company move forward. Another way to reduce the contact is so-called door-to-door teleconsultation, in which physician gains the information via technology such as iPads or just contacting patients while being in a different room. Then we'll enter the room, examine patient, minimize chair and consultation time, and we'll leave the room again to finalize the diagnosis and treatment plan in a different room, again via these technological tools. This was actually advertised on LinkedIn. While being with a patient, we use protective gloves, face mask. The slit lamp should have mounted protector, such as plastic or plexiglass. We then prefer to use disposable materials or single-use lenses, such as those manufactured by Volk. Some other instruments that come very handy are eye care tonometers for measuring eye pressure, handheld fundus cameras, or even handheld electroretinography instruments such as Retival, which are easy to use and easy to clean. All these are very useful. They are transferable, portable. That way we don't have to move the patients among several examination rooms or imaging rooms, and this actually minimizes the movement through the clinic and helps to contain any possible spread. I'm also a big fan of telemedicine, and this is one of the areas where actually telemedicine is becoming more and more useful for providing these services. And traditionally, telemedicine was used for remote areas with lots of patients and few doctors. The scenario for these times is to perhaps reduce the number of patients that we need to see, and Actually, the models that are being set up now for telemedical and teleophthalmic services can actually be useful even once this epidemic is hopefully over. So as we can see, there are various ways that we can protect ourselves and our patients that will help us to continue to care for this patient and will enable us to continue to provide services even in these very difficult times. And with that, I would like to wish everybody good health and best of luck in protecting yourselves and the patients during these very difficult times. Thank you very much.
Останні 150 років ми були піонерами в офтальмології. Розробляючи методи лікування, забезпечуючи інформацією та обмінюючи знаннями з фахівцями по всьому світу, ми даємо можливість кожному дивитись на світ широко розкритими очима. Давайте відкриємо свої очі. Let's open our eyes. There.